Welcome, everyone. We're going to go ahead and get started. Thank you for joining us tonight for our Senior Adult Ministry presentation on preventing slips, trips, and falls. My name is Angie Homelli. I'm one of the committee members, and I'm going to introduce our speakers tonight. Melissa Basile has been an occupational therapist for 35 years. Most of her career was in rehabilitation at Good Sam. She has been working at TriHealth specifically with fall prevention the last 5 years. She's certified to teach stepping on and Tai Chi for arthritis 1 and 2. She loves the prevention aspect of helping seniors avoid falls and remain safe in their homes. And I have to tell you, Melissa, I have referred so many people to their Steppin' On program. It's a really wonderful program. Heard such great things about it from our caregivers that I work with. So thank you for being here. Our other speaker is Cathy Guenthner. Cathy graduated from St. Louis University with a BS in physical therapy, followed by an MBA from Xavier University. She went on to complete her doctorate in physical therapy in 2015. In 1989, Cathy opened her first clinic, which was affiliated with the University Pain Control Center. Several years later, she moved her clinic to the current White Oak location and added clinics in Bridgetown and Northern Kentucky. She has had an extensive experience in pain management, home health, manual therapy, and orthopedics. She's certified exercise expert for aging adults and certified in many fall prevention programs. Cathy also enjoys clinical education of physical therapy students and has worked with many colleges and universities training therapy interns. She's an advocate for providing high-quality care to patients and promotes the care approach for treating injuries with all her staff. Complete attention, results, and experience. Out of the office, Cathy enjoys biking anywhere in the world, skiing, mission work, and traveling. She's also a Xavier Musketeer basketball fan, and she says she tries not to miss a game. I'm pretty sure she doesn't miss a game. So, all right. Thank you so much for being here and joining us tonight, and I will turn it over.
Thank you. Let's see if I can advance our slide. So while she's doing that, the other part of my job besides teaching, stepping on, and Tai Chi is to work with the primary care practices throughout TriHealth, and we are trying to, in every Medicare wellness visit that you go to, the fall questions that are asked to rank you into a low, a moderate, or a high fall risk. You will receive some information in your after visit summary related to whether you're a low, moderate, or high fall risk. If you're a high fall risk, I get an order for you, and I call you, and I say, do you need me to come to your home and do a home visit, which means I just take a look around, and I make recommendations for safety, and this all is through a grant that we have with the Bethesda Foundation right now. So if you go to any TriHealth care practice and you go to your Medicare wellness visit, be honest with answering your questions. Which is, of course, have you fallen in the last year? And if so, how many times? And were you injured from your fall? So I know my mom said she was not honest. All right, so we just have a few statistics in the beginning. Some things to think about. Over 1/3 of people 65 and older fall each year. 2/3 of those falls will do so again within 6 months. Falls are the leading cause of both fatal and non-fatal injuries for those 65 and older. So 30% of those who fall will suffer a moderate to severe injury. 46% of fatal falls are because of traumatic brain injuries, people that hit their heads. Unfortunately, women are more likely to have fall-related fractures than men, and men are more likely to die from a fall than a woman. So fear of falling kind of makes a vicious cycle, unfortunately, that you kind of decrease your activity because you're afraid of falling, you become weaker, and then you fall, right? So that's kind of unfortunately what happens to a lot of people. But the good news is there are things we can do to be proactive and to prevent falls. We have a program called Stepping On, which I'll talk a little bit more about later. But the key things that they have proven and evidence-based things to do are, one is mobility, right, to exercise. That's key to decreasing our fall risks. The next big thing is making sure your home is safe, getting rid of all those home fall hazards. I do have a little handout that I'll give you guys, and you'll just take it home, and it just asks some questions to walk around your house and take a look. Some things, you don't really notice. And when you take a second eyeball at it and you're like, oh yeah, I guess I could maybe trip on that. Or, those things you leave on the steps to walk up because you're going to carry them up there later. I know my grandma used to have them on every step, something on every step. And it's a fall hazard. So can we decrease that? Can we clear our pathways and do all those good things? Medications cause a lot of falls. Okay, you're not sleeping well. You decide, I'm going to take a little PM Tylenol. You get up in the middle of the night and you're a little groggy. You stand up quickly to go to the bathroom because you got to go, and you fall, right? So we have a pharmacist that comes and talks in our Stepping On class, and we talk a lot about medications and how interactions between different medications, and we're going to talk a little bit more about that in the slides. Footwear. We have a lot of people that fall because of the shoes we wear. I was just telling the story that I did have an old pair of gym shoes that I threw on really quickly. It was icy out. I was taking my dog to put him down, and I wiped out with my dog carrying him in my arms. And it was because my shoes were worn and I wasn't thinking. I was in the middle of teaching a Stepping On class too, and I had to tell the story of my fall, unfortunately. And then vision. Vision's a big thing with falls. Kind of being aware of going to your eye doctor yearly, making sure you know what your visual deficits are and getting them corrected as best you can. And then thinking about lighting, because lighting helps our decreased vision as we age, right? So those 5 things are key. We're going to talk about several different kinds of courses you can go to. Cathy has taught and is certified in teaching some courses, and I am certified in teaching a couple others. So it's great. Any of these programs are wonderful fall prevention programs that you learn a lot of good things at. So if you see them out there, I highly recommend you sign up for them. So Stepping On, A Matter of Balance, Stay Active Independent for Life, which is SAIL in parentheses, Tai Chi, lots of forms of Tai Chi are getting out there. These are all evidence-based programs. Bingo Size is actually another program that is new, and I don't know if you guys have heard of that. It's kind of playing bingo but learning education as you're doing it about falls, so it's interesting. And then the Otega, am I saying that right? Otega exercise program, which is a great, wonderful program that PTs teach. All right, so one of the handouts we're going to pass out is one you take home and just look around your home. And the other handout, if you just want to pass this one, you can pass all 3 of them out. There's actually 3. The first one is one that you can just take. It's a little quiz the CDC puts out that if you answer or score 4 or more, it means you have a potential fall risk hazard. So you want to make sure that you just answer those questions, but then the other one is your home assessment. So we'll just hand those out. All right. We'll switch to Cathy.
All right, thank you for all coming. My name's Cathy Guenthner, and I go to the 7 and 9 p.m. Mass, so I switch back and forth, which is unusual for our community. But I wanted to talk some ideas before we start about how you can assess your own ability to prevent falls and your flexibility, strength, and motion. So I think it's important to recognize that the human body is a miracle. From the moment of conception, the woman carries this egg and cell to its birth as a child, and it's a human being that is moving and coming out when they're born. Well, your body is the same way. It can heal itself by taking care of itself. So you can move, strengthen, and be flexible and become stronger. And you can do it yourself with some exercise and guidance. And some of these classes require attendance. Some of the classes require seeing a physical therapist, and then Melissa's class is a week for 8 weeks, or an hour a week, 7 weeks. So I wanted to start with the idea of the balance of your body and needing strength and flexibility. So your muscles cross from your pelvis to your knees to your ankle. So when you have tightness, because we all sit too much, and when you stand up from sitting, you'll feel some tightness, it doesn't allow your legs to move properly. So when you take your first step, when you're not walking in a normal manner, it starts to throw you off balance, and you're at risk from fall just for walking. So we encourage, both these programs, the Ortega and the SAIL program, go through a sequence of stretching, strengthening, and mobility exercises, and end up with the balance routine for that single leg stance movement in time. So let's go on. This kind of describes the two a normal pattern gait and an abnormal pattern gait, which I was kind of referring to. But if you're walking well, your hips are behind the leg in front of you. And if you ever look around in your community, a lot of people have short steps, and that throws off your base of support. So the exercises are designed to give you the length of the muscle, the flexibility, and the strength to move appropriately. So the two programs I want to talk about are the Ortega Balance Program and the SAIL program. The SAIL is the Stay Active Independent for Life. The Ortega program is more of a one-on-one program that's focused on balance routines that help you, move freely and have unilateral support so you can stand on one foot and not fall over. And, if you're reaching up into your closet, you think you got it, and the next thing you know, you're laying on the hangers in your clothing that you don't have it. So it's an independent one-on-one program to strength, balance, and flexibility. And where the SAIL program kind of mimics the American Heart Association has the guidelines of 150 minutes of strenuous and vigorous exercise a week. It mimics that because it has a warm-up program. It's a 55-minute class, 2 to 3 times a week. And you start with a warm-up, and then you have aerobics, strength training, flexibility, stretching, education. We cover some of the same topics, and balance and cool down. And the nice thing about the SAIL program is it's a community program. So you'll have 15 to 30 people, depending on the number of instructors. And we did it at the Green Township Senior Center for 5 years, and people just loved it because they were moving. And the average person, surprisingly, as you age, doesn't usually walk for longer than 2 minutes at a time unless they're really thinking about it. So this class gets people working together, then they carry over on their own. Let's see. So the target audience is very similar. That it's both for people 65 and older. The Ortega program started in New Zealand, and it focuses more on the 80 population, and they did the one-on-one sessions in people's homes. Here in the United States, most of those are done in a physical therapy office. The SAIL program I mentioned earlier is more of a class, and it kind of balances fitness with balance. The components I kind of referred to already as well. The Ortega program is totally balance-oriented, and the SAIL as a strength, flexibility, balance, and aerobics. All right, well, we covered this too. Let's see. So the Ortega program, I kind of wanted to do a couple of the tests that are common to both programs. If you can stand up and if you can move into the aisles a little bit, like the center aisle here. You don't have to if you don't want to, but it'll give you a chance to. So the first thing would be just to put both your feet together. And then put your arms across your chest. So far, so good, right? So this is the first balance position, and everybody pretty much does this pretty well. Now you want to take your one foot and put it next to the other, like in the arch. Can you see? Yeah. And you want them to touch if possible. And then put your arms across your chest and just look straight ahead. Well, the group looks pretty good so far. Okay. Then the next one is to take the foot in front of the other foot, toe to heel, or heel to toe, how you want to call it. Yeah, if you can't, hold on to the table, hold on to the pew, and get yourself in the position first. And then once you got the position, stand up straight, because your body's made to be straight. And take one arm, the outside arm, part across your chest, and then the inside arm. And just focus on something, and that'll help you balance. Okay, that's good, everybody. Then the last one is to, again, balance on something first. Put your hand on something for your balance. Bend your knee up behind you. And then put one arm across the chest, then the other. And feel comfortable just holding on if you need to. That's good. Everybody can relax now and just sit for a second. But what it shows you, you yourself know the best, how you felt and your confidence in doing those different activities. So just allow yourself to know that you can achieve those strength and flexibility, allow yourself to be stable. The other thing that you should be aware of is if you have any hip or knee or even ankle foot pain, the joint receptors, which are nerves that go to the joints, if they're feeling pain, you're going to get that waffling. So if you can't control it by overpowering it with your strength, not overpowering it, but take and manage it, then you should go see your doctor or a physical therapist to get that pain under control, because that will also put you at less risk for fall. Because if you can't feel the joint properly, you don't know where your leg is at space, that you might slip on water, uneven surfaces, and end up as a fall. So that's a common balance test that everybody pretty much uses to get started. And then, let's see, you all can sit down now if you want, I think. These are some of the Stay Active and Independent for Life SAIL program. If you look at the list of exercises up there, they do the single leg stance, the heel raises, the toe raises. So the toe raises are your, or these are heel raises where your heel's going up, and then your toe raises is coming up this way. And I'm not going to be able to do it today. But to do that, particularly the toe raises, you need flexibility in your gastroc that I was referring to earlier. And then the single leg stance we all experience, so you need strength and balance, and you need awareness of where your joints are in space. So if you have a pain that keeps you from being aware where your body is, you don't realize it until you put it in that position. And then there's some general strengthening, the single leg raises, hip extensions, and then balance on foam. The single leg raises and the strengthening is actually very similar between the Ortega and the SAIL program. But the Ortega has listed here a few more balance activities, the tandem stance, and then there's, which is the one that we all did like this, and then the tandem walk is when you do this. So they have people walk back and forth for 5 feet to work on their balance. And then forward and backward walking, sidestepping, are all just general components of strengthening and balance awareness. And then we can do more after Melissa goes on with her talk, but it's a good warm-up. Thank you.
So, the dreaded fall. We've all had them, right? I mean, I don't know many people that haven't fallen, right? So being prepared and kind of thinking through, what if I do fall? What do I do? Those kinds of things are kind of part of the Stepping On program. But I just want to do a little bit here because I want you guys to think about it in your homes. So obviously we want to protect our head because that statistic that said, you know, it's a brain injury that we die from, we really don't want to hit our head. Kind of turning as you fall, keeping your arms and legs bent, staying loose, kind of roll with the impact. And it's hard to think that you can do this when you know sometimes you've fallen so quickly and you're not realizing you're going to fall, right? So what I say is do the best you can, right? Our first inclination is to stick our arms out and we all break our wrists, right? But If you think about it, you know, if you can just kind of tuck and roll and stay loose, you're less likely to break those wrists and those kinds of things. Okay? So you've fallen. Okay? The first thing you want to do is to take a breath and assess your body and think, did I hurt myself? You know, can I feel my body parts? Does something really hurt? And if something really hurts, you probably shouldn't try to get up, right? So that's what you want to think about. If you think that you're okay to try to get up, then we're going to talk about how to do that. But the other issue and the things that we talk about a lot of times are you prepared to fall in your home by yourself, and how are you going to get help if you can't move? So I have been in many situations, many stories from people, people that have had their lifeline, they live by themselves, they don't like the neck thing, so they hang it on their bedpost in the middle of the night, or before they go to bed. They get up in the middle of the night to go to the bathroom, they fell in the bathroom and they laid there for a day because they couldn't get up. And they're severely injured. Okay, that was one lady. I had another guy who didn't have any kind of alarm system, and was in a wheelchair, went to the bathroom, fell, couldn't get up, was there for a day. So those are the horrible stories, right? I mean, that would be awful to be by yourself and to think that, you know, you're going to lay there you're going to die there is what you're probably going to think. So what are some ways, and I want you guys to tell me, what are some ways that you can make a difference with that? What are some ideas you guys have?
The Apple Watch and
And
know
ha-
how to use it.
And I was going to say, and how do you do that?
I think you push this thing until it goes SOS or something. I mean, I'd be able to figure it out. I've gone over a bump on my bike and it's gone off.
Okay.
I just don't want to call 911.
Okay.
unnecessarily.
So there is a fall detection on your watch, and if you have it set for that, and you have the newer watch, I mean, I think they've been that way for a while, but you want to make sure that's on, right? So
I don't, my therapist says I have to keep my phone with me at all times. So when I get a shower, I put it on the floor outside the shower, because if I fall, won't be able to reach it up there on the. So that's, and otherwise it's supposed to be in here, and this is supposed to be with me.
wonderful, wonderful. Having your phone on you at all times. Now, that's a recommendation I give to people who aren't willing to do any form of lifeline. And I had a guy in one of my stepping on classes, he literally made this necklace, this pouch that he would keep his phone in his pouch for, oh, you're waiting to raise hands. They keep waving back there. I'm wondering what to do. Okay. Okay. So lots of different things you can do. What are some other, anybody have any others?
So the thing I was going to suggest, my name is Jesse. I'm an Apple genius and technical expert at the local area. So if you guys have any questions about fall detection, how to use your Apple Watch in emergencies, or what that button does, see me after the seminar, and I'll answer those quick questions for you. Okay? All right. I'm a genie. You get 3 wishes for today. Okay, but I'll help you out. Okay.
Wow, that is wonderful. Thank you so much. How about any other ways?
My sister put Siri, little, whatever those are, towers or whatever, throughout the house. So if my brother-in-law fell, he could yell, Siri, call Brian or one of his kids. But he fell, and he forgot to call Siri. And he did not have his lifeline on. He took it off on the bedside table, just what you said, walked in the bathroom and fell. And he had to crawl out to the telephone because he forgot to yell Siri. But he has Parkinson's really bad, and I was thinking his voice is so diminished. I don't even know if he could say it loud enough for the Siris to hear him.
Yeah,
But if you have a loud enough voice,
right,
that would work too.
right.
They have it everywhere.
couple of things. One might be the footwear that we have. Personally, I prefer the lower. I know a lot of very popular footwear has a very thick sole to absorb a lot of shock, but I think that changes the dynamics in terms of our standing, and so something that's a little more close to the ground may have some advantages. Something that I have not personally really participated in yet, but not too long ago, I was reading an article about some of the blue zones throughout the world where people live to a long time. And I think it was in Okinawa where in the household there were very few chairs. So people were spending time sitting on the floor or on a mat as they're eating or whatever. And of course, as you're sitting, you have to get up. So just for muscle tone and strength and balance, that seemed to me to make a lot of sense.
Yes, I did watch that Netflix series, and it was excellent. And that is one thing, people that get up and down from the floor or that do a lot of stairs, those are the people living to 100. So movement, balance, all those good things that we're talking about. So what about anything else with Lifeline, those kinds of things?
I fell in January. It was a very slow, graceful fall. And I
Very good.
and I fell onto my foot. I ended up breaking the foot.
Oh.
And I was pushing myself up, and I ended up irritating my arthritis in my shoulder. And I live alone. And so a guy at church said, you know, you can do something with the fire department and have a key outside your house where they can get in and get you if you don't want them knocking your door down to get to see you.
And that is called a Knox box. It's Knox, Knox box. And you can do that. You need to call your local fire department and make sure that they have that. We cover that in our stepping on class, depending on what county we're in. They do it differently with the fire departments, but that's a wonderful thing.
The other thing you can do for the for 911 is there's an app you can put on your phone called Smart 911, and it knows where you are, and then if the emergency department gets a call from that phone number, you can put in notes, like if you have a garage code, or you have a pet, or you can put notes in there about even your own health, like I have this health condition, or I'm allergic to this medication, or anything you want the fire department to know when they come. You can do that. Smart 911.
And I do know I was up at a class teaching in Mason, in their community, whatever that county is, they do not have Smart 911, but Hamilton does.
Warren, yeah.
Warren, yeah. So, and I do have that app on my phone. I love that. All right, so let's say you're not hurt. One other thing if you are somebody who does not want to get technology, I have a mother-in-law like that, no technology, no phone, no nothing. Doing something with your neighbor. Like in the morning, pull up your blinds. Your neighbor checks every day to see if your blinds are up by a certain time. If they're not up, they're going to come check on you. So there's simple things you can do that don't cost money to kind of keep track, or have a relative, child, aunt, uncle, whoever, give you a call once a day. I mean, at least you're not going to lay if you've fallen for more than a day, right? So at least do that. So we have fallen. All right. Cathy, you want to fall? And I'll talk you through it, or do you want me to fall? Okay, so she's down on her back. She's fallen. All right. She's assessed herself. She's decided that, okay, I think I can do this. So the first thing she wants to do is kind of bend her knees up so that her feet are kind of on the ground. And then she's going to roll to the side and then push up. She's quick. She's going to push, hold on. She's going to push up to get to all fours, okay? And then she can crawl to a chair, to a sofa, to some sturdy piece of furniture to be able to put her hands up on the chair, and then one foot up, and then kind of turn and sit in the chair. So technically that's the way that you want to try to get up from your fall. Now some people will say, well, I can't go on my knees like that. I've had knee surgery, I can't go on my knees. So we kind of call it the butt scoot. So you can take your you got your legs flat on the ground and you can kind of just scoot your hips backwards and kind of help push yourself to a chair at that point. Okay? Does anybody have any questions about that? Can you kind of picture that? And somebody told me that they went to a course and said, go to each one of your rooms and think about if you fell in that room, where would you go to get up from? I thought that was a good idea, kind of a nice thing to think about. Okay? So some things to think about, it's hyperthermia, when you're laying there, you're cold. Unfortunately, a lot of times you'll have accidents, those kinds of things. So if you can, trying to get comfortable, put a pillow, if you can grab anything, try to keep warm, a blanket, anything you can grab to just try to stay as warm as you can until hopefully, someone is alerted that you need help. If you have fallen, make sure that you have let your doctor know that, okay? A lot of times, you don't know that you're injured, right? And you think you're okay and you get up and something's kind of nagging. So just make sure you call your doctor and say, hey, I fell, and let them kind of assess whether they think you should go come in and get checked out. There are things that happen in our brains with like a slow bleed. Maybe we kind of barely hit our head, but as we get older, things like that happen, and you don't notice it at first. So just make sure, especially if you've hit your head when you fell, that you let your doctor know. Okay, let's talk a little bit about medicine. Who's ever done this? I kind of did it this morning. I take some at night, and I went this morning, and I'm like, oh, crud, my pill box isn't sitting out. I didn't take those last night. So I'm sure we've all done it, okay? Has anybody in here had a fall because of their medicines? Okay. My mother-in-law did. She was taking some medicine. She was having some dizziness and some just not feeling well, and the doctor prescribed a new medication, and it made her worse, and she fell down the steps backwards, unfortunately. But it was because of her medicine that she fell. So that brings another point. I think this is on another slide, but while we're talking about it, if a doctor starts a new medication with you, you want to make sure you know about that medicine. You want to make sure you know what the side effects are that most people have, because if we read the label on most things, there's all kinds of side effects on everything. It doesn't make sense to us. So just make sure while you're in there and you start a new med, you say, hey, what are the side effects I should be looking for? When should I take this? Should I take it with my other medicines? Should I take it with food? There's all kinds of questions you can ask, and if you want to write these questions down, it's actually on this PowerPoint. There's the next slide, I think, has, what are some key questions to ask. Personal medication cards. I had a situation where my husband and I were walking in a park, and we came upon a woman who had passed out, and her husband was frantic, and they were elderly, and I wasn't sure what happened to her, but I asked him, does she have low blood sugar? Does she, and he was just so flustered. Finally, she came to enough that, and I was saying, does she have a medication card? And she said, in my purse in the truck. Went and got that. So by the time 911 came, I could give that to them. They know what medicine she's on. They know what she's taking, what her issues are. So carrying a little pocket medication list is very helpful, making sure you have one in your home somewhere posted, either on your refrigerator. If you're living alone and an emergency squad comes in, that's where they're going to look. They're going to look to see if you've got anything hanging, so that can be helpful for them to know quickly what might be going on with you. So we talk a lot about that in our class. You want to make sure you put everything on that too, because you never know what medicines interact with other things that are prescribed. So you want to make sure you list all those things. And when you go to your Medicare wellness visit, you want to say to your doctor two things. Can I stop taking anything I'm taking? Or can I decrease my dose of anything I'm taking? Because sometimes as we age, we don't need the same amount that we did before. So it's always a good review once a year to specifically talk to your doctor about your medicines. And I know a lot of people say, well, my appointment was really quick and He doesn't have time to do that. They just ask me, is this correct? And I say yes. But you need to be an advocate and say, can we specifically talk about each medicine I'm taking and make sure that I understand what it is and why I need to still take it? There is also, with the pharmacist, Medicare Part B once a year. You can call your pharmacist and schedule an appointment with them to sit down and them to specifically talk about your medicines as well. So just know you have that ability. So these are all the questions to ask. What if I miss a dose is a good one. I think we talked about all the other ones. What's wrong with this picture? This is a real picture of a woman who broke her hip and came to the orthopedic surgeon for her appointment after her hip was fixed. So, we talk a lot about shoes, and thank you for bringing that up. So, shoes without a back support, shoes that are high. A lot of those gym shoes do have the higher heel. So looking at the support, the fit, the heel, and the sole are really important. Turning your shoe upside down and looking at the tread, making sure that you still have tread on those favorite shoes that you've worn for the last 10 years. Because believe me, you probably don't. Okay. So the key concepts for the Stepping On program, and Pam has been to the Stepping On program, so she can attest to this. We do talk, we have a physical therapist that teaches 4 strength and 4 balance exercises, and they were a lot of the same ones that are in the other 2 programs because they are evidence-based. They've been proven to, if you do these religiously, and we try to encourage people to do the balance every day. Do your strength every other day, but do your balance every day. We're not doing the same things we used to do when we were kids. We're not reaching and jumping and doing all those things to challenge our brain and all the things that work our vestibular system to be balanced. So we need to challenge it every day. So again, you can do things while you're cooking, while you're brushing your teeth. It's very simple. When there's a TV commercial, get up and do those exercises. So we can make all the excuses we want, but we do have time to exercise, right? Tai Chi is our other program, and it is, I never thought I would be a Tai Chi instructor, but I do it, and it is very relaxing. It is peaceful. The program that Dr. Paul Lamb developed is for arthritis/health. You don't have to have arthritis to do the program, but the key is that the stance that we use is higher. A lot of times when you see Tai Chi, if you've ever watched it, it's like these big movements and you're low. This program is higher stance, and it really focuses on our body movements, really changing from one foot to the other and getting a feel for how our weight is being distributed as we move, so that when we are doing things, hopefully our body recognizes that and moves that way, and it moves a little bit safer. So our Tai Chi is an 8-week program. Once a week you go for an hour. We learn a new move every week, and at the end it is the movement that you can do. And again, you can't do it on your own. You got to kind of watch somebody for quite some time. It took me a good few months to be able to do it on my own, just from my own self versus watching somebody do it. So you do need to practice. But it is a wonderful program, and at the end, if we have time, I'm happy to show you guys the actual series of movements that you would learn how to do. It's kind of fun. The Stepping On is 7 weeks, once a week for 2 hours. So that's what you do. Oh, I'm moving the wrong way. I'm like, didn't we already do that? Yeah. So real quick, just some things. Something's wrong in these pictures. Does anybody notice? This one's an actual home visit I went on. So having cords by your bed when you're going to get up in the middle of the night and go to the bathroom. She kept her step stool in the middle of the kitchen. She was getting ready to lift a big pot and put it in the refrigerator. Do you think I cringed? So just some before and after. So some things we've done with the grant. This was a home that didn't have steps in the basement, and so we put a rail up. This was a scary steps on the left side, and then steps that are lighted and have handrails on both sides would be the safest. A lady had fallen on her hardwood floor steps because she had socks on and walked down the hardwood steps, right? So she ended up putting these treads on her hardwood, and they looked very pretty, so I took a picture of those. They ended up really nice. This was the gentleman, unfortunately, that fell in the bathroom and got stuck. So we ended up getting that bedside commode out of there because really he had a wheelchair and it was in the way, and put a toilevator. It's an elevator on your toilet. So if you look at the base of the toilet, it actually raises the toilet up. Added a grab bar for him, and he has a flip down bath seat. He already had a cutout for his tub. I don't know if you guys have ever seen that, but they can take a tub and actually make a cutout so that you don't have to step over that big lip. So he had already had that in there. Just some ideas. So this was somebody who didn't have a grab bar. We added their grab bar. There are some fancy grab bars these days. Some people really feel strongly they don't want to do anything in their home because the next person won't want to buy it if there's grab bars. I say everybody needs grab bars. I say children need grab bars. There are pretty grab bars now that match all of your different kinds of hardware that you have in your bathroom. Okay, polished nickel, all those different things. If you go to Home Depot, Lowe's, there are all kinds of pretty ones. This is an actual toilet paper holder that is a grab bar if it's put in correctly. So if you go to lose your balance a little bit, you know, with your eyes closed, you're washing your hair, whatever it is you're trying to get your feet, you know that bar's there, you're going to grab it. Versus, you know, people say, oh, well, I hold on to this. Well, if you really need to hold on with your weight as you're falling, that thing's not going to stop you, right? So just think about that. The suction grab bars, I don't recommend them. I know some people have them. I know that if you check them frequently, they can, you know, be okay. But I prefer to know that that grab bar is going to always stay there. We had some suction ones at work for years, and they would eventually fall off, which makes me think twice. You know, that time that you need it, is it going to be the one time that it's going to fall off?
Well, can you put grab bars on a shower that's been redone, that's like Formica, like I rent, but it's not the old tile? And I didn't know if I should even
So we work with whole home modifications. They're the other side of people working cooperatively, and they have done some that are like the fiberglass surround sound kind of showers. If there's enough room between the wall and the back of the fiberglass, they can insert some cement in there, and they can make them safe grab bars. So they kind of have to evaluate each person's, you know, on their own. But I wouldn't say because you have that you couldn't add that. I would definitely have it checked out to see if it's something you can add. And when we do home visits, I did one today with somebody that rents, and I'm basically gonna, you know, give the recommendations, but they're gonna need to make sure that the landlord or whatever is either gonna approve us doing it, or we have in the past purchased the equipment, and then their, you know, handyman guy was the one who put them in. So, yeah. This woman did get into her shower, and she put her hand on the wall and just slipped down and fell into the shower and hurt herself. I think she broke something. So this is a surround sound. This is kind of one that was a fiberglass one. You can't really tell because it's colored, but they were able to put those grab bars in there, and it looked nice. This was someone who was in a wheelchair, and that threshold, he couldn't go out his front door, so they just added a little extra rubber ramp where it kind of levels it out so that he could go in and out himself. A lot of people have that step out of the garage and kind of just need a handhold there as they're doing the step, so just a simple grab bar outside that door is helpful, and all kinds of different railings that you can get on steps. Lights. Has anybody fallen because you were in the dark, maybe? Okay. I had a friend who was out at our lake, and we were getting off the boat, and it was dark, and we all know to step out. Well, she didn't see it, and she stepped down and fell and broke her arm because she fell kind of into the water. So we now have a lot of lights on our dock. So unfortunately, learning the hard way, having light is key for us as we age. So night lights, motion night lights, things that go on when you walk in a room are great. Does anybody have any questions, comments?
That's what you said about when you're walking, when you're walking, you said something about 1 foot is forward and your weight is someplace else. You can see I really misunderstood it.
So Kathy was talking about just your hip is kind of behind you. I mean, when you walk, you kind of walk heel toe, right? And then your body kind of catches up with you. So your foot comes out, you do heel toe, and then your hips kind of catch up with you, I think is what you were talking about. So having that flexibility to do the heel toe and to have that hip move forward is the way we want to make sure we're walking, right?
Thank you.
Does that make sense?
Sort of. Thank you.
Okay.
How else would you walk?
Well,
I
sometimes
don't know.
sometimes I don't pick up my toes and I kind of catch my toe, especially when I'm walking at the airport for some reason. But if we don't have that strength in our front of our leg to bring our toes up, a lot of times we will kind of catch our toe. So concentrating on making sure the heel strikes first and coming through that gate. Kathy, she's the PT.
I mean, that's a good question, but people, what I was trying to describe earlier is when people become fearful of falling, they actually think they're protecting themselves by taking shorter steps. But that puts you at an inefficient, like you're more at risk for falling with shorter steps. What you want is a regular stride. You almost should exaggerate it. And if you let your arms swing with it, that gets your whole trunk working to your best ability. I'd be glad to look at your walk if you like.
I don't have a natural arm swing, at least I don't now. I maybe did. So just practice in doing the...
In your home, in like maybe a narrow hallway where you feel safe, you can really just exaggerate it so that if you do lose your balance, then you're just kind of have something to reach for. You should work on that. Yeah. Part of the Ortega or SAIL program is like also just with walking forward and walking backward actually helps you get a normal stride and arm swing as well, because your body just moves that way.
I have a road ID, which only costs $25 or $30, and it has my kids' phone numbers on it. They got it for me so that if anything happened, someone would know who to call.
Wonderful.
Yeah, they're very inexpensive. It's called a road ID, R-O-A-D. Naturally, my son works for the company, so I'd be happy to tell you about it. And also, you might notice that Bellarmine just put in grab bars back there, to go up on the altar. So that's
Wonderful.
Yeah.
Yay, Bellarmine. I had somebody who had an Apple Watch, I think, and I think it was a little piece that she added to the watch, and it was one of those. So that might be it. Wonderful. Yeah, yeah. That's great.
Just a couple comments. I know of two people, unrelated to each other, but were at a strange house and were at a party, and they thought they were going into the bathroom. They opened a door in a hallway and just stepped, and it was the basement. And one person, unfortunately, passed away from his injuries, and the other person had such serious injuries that it took months to recover. So I almost thought, I mean, older homes sometimes have where you open the basement door, there's like a landing first, but a lot of newer homes don't. You open the door and right there are the steps. So, I mean, I almost thought, gosh, put a little, placard thing that says basement or something to, or, to help people, or just be ultra careful if you are in a different home to, know where you're actually going.
Absolutely.
And then one thing with me, I can tend to have that where you get up too fast, where you're a little dizzy or whatever. But this was a time when I was like fighting off a virus or whatever, and I went to go hit the thermostat, and I started feeling lightheaded. And I thought, well, I'm right here. I had literally like 8 inches to press the button. It's only going to take a second, and I didn't have a second. And I passed out, I was probably dehydrated and, just lightheaded, all that together. And going down, I had a small lamp in a bag to go out, and it was in that corner. And I fell on that and gratefully hit my brow bone and not my eye, because I probably would have lost my eye. So that was my lesson, that if ever I'm feeling lightheaded, just get down. Just get down close to the floor right away, and don't assume that you even have a second to, deal with it or whatever you're doing.
That is a great point. And in our class, we tell our false stories. That's how we meet each other in the beginning, is we go around the room and we each kind of tell our false story, and we all learn from each other. I mean, there are all kinds of ways we can fall, unfortunately, but our goal is, when you do fall, we want you to ask yourself some questions. Why did I fall? I fell because I wasn't feeling good. I was feeling dizzy. And is there something I could have done differently to keep me from falling? So when your friends tell you stories about when they fell, you might want to ask them those questions and just say, well, why do you think you fell? And as a therapist, I used to question the patients, because I'm like thinking, was it their vision? Was it their, what was it that caused the fall? And is there something we can do about that? So those are great things to ask yourself. So thanks for sharing your fall story. Where's our microphone? Oh, sorry.
Has anyone else noticed the bright lights outside over the last 5 years that are LED lights, and they're everywhere? I'm just wondering if you have any comments about whether the brightness of those lights have helped people. I mean, I know that they're to light up parking lots and light up areas that are normally kind of dark, but I find them very distracting and glaring, so that, I sometimes can't even see for all the bright lights. And I know they're not necessarily in the house, but the LED lights are becoming more and more popular. I just wondered if you have any comments about the lighting and...
I know some people do prefer different, and you go to Home Depot and Lowe's these days, and I have no clue what light bulb to buy anymore, because there's 5 different choices of everything, single light bulb, right? The soft white, the makeup light, whatever. There are all kinds of choices, and some people do prefer some over the other. But I don't know if you have anything to say about the LEDs, other than the lighter, the better, in my mind. But if you feel like it's blinding, maybe it's in the wrong position to what you're doing. So it can be not good. Hold on one sec. He's got the microphone. You're next.
This is about falling while walking. One Sunday morning, I was walking right down the drive here and tripped, fell flat on my face in front of the student, whatever, the building down there. Used to be Fenwick Hall. It's now Freedom Hall. Anyway, Judy was with me. I hadn't been drinking, but well, that ultra wine. There was a very slight rise in one of the cements, and I had developed the habit of very shallow footstep. I needed to learn to raise my feet higher and to watch where I was walking.
Thank you for sharing that. A lot of times it is, paying a little more attention. Sometimes we get distracted. We're carrying things. You know, we got a lot on our mind, and that is a reason for a lot of falls. But picking up that foot and learning that, and I'm glad you. How did you go to PT, or did you just kind of learn it yourself? How did you? More attention. Okay, good, wonderful.
I was just going to tell you my fall story. I have poles that I really recommend to everybody. They look like ski poles, and I use them when I walk, and it's great because they come out.
Walking sticks.
Walking
Yep.
sticks. And so it's like you're four-legged. You can climb up hills better. It works on your upper body. I love them. But one time, I was in the woods. I had the poles. I was coming down a hill. I lost my balance, and I had the straps on my wrists. And because the straps were on my wrists, I just got all tangled up in the poles. So the poles were hitting me this way and that way, and I think I cracked some ribs, and it was a mess. But I really think the poles are great. If anybody can get those, they're great for balance, they're great for strength, but don't use the wraps around your wrists.
Thank you for sharing. We do talk about walking poles, and we do like them.
I just wanted to make a remark about if you fall and hit your head, you have to go to the doctor. I fell and hit my head pretty badly. I got a big knock on the back of my head, and my sister was a nurse, and I called her. She said, this was just recently, like within the last year. She said, go to the ER. You never know if you've got a bleed. There's a parishioner that comes to Bellarmine, and she fell and hit her jaw on the coffee table, and it was sore and it hurt, but she didn't do anything about it, and she had a bleed, and she was in the hospital for 3 months, and she still has cognitive damage from the bleed she had. So if you hit anything from the neck up, go to the hospital.
Thank you, Pam.
You wouldn't think that would do it.
I'm glad to hear some positive about stairs, because sometimes when I try to tell my friends stairs are your friends, they make me feel as if I have to defend the fact that we still live in a house with stairs. But then do you gradually get to know the time when you shouldn't be doing stairs anymore? Will I know when I should give up stairs? Do you want to answer that?
I think you answered that for yourself. I think you'll know when it's time to give up stairs, and just make that decision. You know, don't let yourself say, oh, I should keep going. If you're having some trouble, you're having trouble, and it'll become more and more evident. So when you go up and down, is your bedroom on the second floor?
Yes.
So like if you're doing 10 steps, and right now it's easy, and then all of a sudden you're realizing each step gets harder, then that's the time to move the bedroom downstairs or move to a first floor. But listen to your body will tell you.
Good.
I was going to say about one more thing here about the falls in your head, particularly if you're taking like the baby aspirin or a blood thinner. Don't stop or pass go, call the doctor right away. Just go fix it right away.
Back to the stair question, I'm actually curious, if you are able to do stairs and have the strength to do them, do you encourage it? Because I would think that would help keep your legs strong. Any philosophy around that?
I would just, I mentioned earlier that if you're having any joint pain, like if you feel you have hip pain or knee pain, everybody has joint pain at some point, and you're going up and down the steps, and that's a little harder. If you're really if it's becoming more and more an issue that you actually find yourself doing one step at a time on a particular day, and then you do it for like a week, that's another time when you should say, okay, something's not right here. And you know, you could go to the doctor and to a physical therapist and find out what the cause of the pain is that's not allowing you to transfer the weight step over step. And they might tell you it's time to give up the steps, or they might be able to help you do it for another 10 years. So it depends on your body and your age.
Many of us have multifocal lenses in our glasses. If you have a bifocal or trifocal, don't climb the steps with them on, because it changes your perspective and the possibility of fall is quite great.
If I could address that, I'm not when I go up the steps, I have them on. But when I go down steps, I take them off. Because I feel like I can see very well going up with them or without them. But going down, I do see better without them.
There have been a number of very good suggestions here of things to do. And just to comment, just say that there's an issue and a physician or whomever says, well, do this 10 minutes a day for 3 times a day and everything. Well, that's all well and good. And if a person did that, it probably would work out. But my experience has been that the most effective types of exercise are those that I will consistently do daily.
Why do you do them?
Pardon?
Why do you do them?
Well, if it's something that I like, or and that's probably the biggest thing.
Yes.
Liking it, and then if I think that it's good for me, but I just know that certain exercises that I do, if I say I'll do it 10 times a day, you know, I start missing days. 5 is a magic number for me. Yeah, I'll do it. I've got a 7-minute routine that I will do consistently. If it was a 20-minute routine, it probably would be better for me, but I would end up doing it every week or so. So whatever you could do consistently on a regular basis, I think that certainly has a lot of value.
Some movement is better than no movement, right? And people tend to do the exercises or like I love to bike too. And so that's how I get a lot of my exercises. I bike because it's what I enjoy doing. So finding something you enjoy that will keep your joints moving and keep your body moving, whether it's walking with a friend, right? Get a buddy. A lot of times we will do exercises because someone else calls us and says, hey, you want to go for a walk? And then you're kind of held accountable to that, right? Or I do much better taking a class. If I say I'm going to do it at my house, I don't do it. But if I know I got to go to that class scheduled at that time and it's one that I kind of go to, people say, oh, hi, they know you and they're like, oh, you haven't been here in a while, right? So those kinds of things are really helpful. If you're trying to do it on your own and you're not somebody who's ever enjoyed doing exercise, it's really tough. So you've got to find something that is going to motivate you. I'm kind of motivated because I know I have decreased circulation and I want to keep my legs working. And so I know I want to keep moving them so that I can not be in a wheelchair when I get older. So, there's things that motivate, different things that motivate each of us. But movement is good.
I'd just like to follow up with that because the Otago program and the SAIL program they say the most success is when the people participate for a year. In the SAIL program, they say they need 75% of the scheduled appointments for success in Otago. It's less because it's one-on-one with the physical therapist and then the follow-through is on their own. I mean, as you mentioned, and you've mentioned that it's hard to commit to exercise and do it on a regular basis, but I think if it becomes part of your lifestyle that gives you more mobility and gives you the independence to keep doing stairs or the independence to walk from wherever you park on the street into Bellarmine, it'll become a focus of your life. But it'll happen when it's time for you to do it. That if you need to do it, you'll do it, and if you don't need to do it, you might not do it or you won't. It's your choice, but your body is something that can be retrained for the rest of your life, that you can come back to it and keep it functioning in a good, positive way with exercise. And as little as 30 minutes a day. It doesn't have to be 30 minutes at a time, but spread out through the day, and that includes walking as part of it.
Yeah, we kind of take all the negatives about exercise, and we have a big list that we make, and we try to turn around that negative to a positive. What is the good of, you might be too tired to do exercise, but if you do exercise, what does it do? It gives you more energy, right? So there's a lot of things that we make excuses and we don't do it, but really we can kind of turn it around to be a positive. So for our health and for our enjoyment in life.
I would just like to add, I think our Medicare program is phenomenal. I'm 69, and I've been on Medicare, I guess, for 4 years. But they offer all sorts of stuff, well, besides silver sneakers. But there's a Hinge program that they give you it's an app. There's all sorts of things out there. Now, I'm not the healthiest or best for my discipline, although I used to be a professional golfer. For some reason, I cannot get into doing all this exercise. But there's a lot out there. So I'm just saying the Hinge program and the Medicare program, and thank you to all of you who give us, the physical therapists who give us so much to work on.
Thank you. Anything else anybody wants to share?
Excuse me, I was just going to ask if anybody wants to do like 5 exercises. We could do 5 exercises that will improve your stride length and then improve your ability to walk and move around. Yeah. So I'd like you to get like in the aisles next to someplace where if you need a balance check, you have it. Or you could sit next to the chair there, too. Okay, so basically put one hand on a pew or a chair where you're standing next to for balance, and with the leg that's opposite it, take a big step forward. Now, keep your trunk straight. So don't be bent here at your waist, but try to keep your body upright. And then bend that front knee a little bit, keeping your trunk straight. Okay, in this position, you should feel in the back leg a stretch here and in your calf. So that's going to help, one, it's also a stride. So you're working on your balance, you're working on stretching, and the evidence shows that you're actually working on core and hip and leg strengthening during this position. So ideally, I ask people to do it for 30 seconds, and if you can raise your outside arm up too, it kicks in a few more muscles. Yeah, any way you do it, it works anyway. Now switch legs. So take the inside leg forward. Bend, keep your trunk straight if you can, and then bend your knee a little bit. And then put one arm over. All right, that's good. Let's see. Well, most people, their right leg and their right arm is the dominant side, but it really varies from person to person, and the shoe wear that you have, and if you have any pain or muscle tightness. So, face the pews where you can put your arms on it. Yeah, both arms. So you're facing it like this. So your hands are on something. But you need to be able to move around it. So right there, yeah. Can you put both your hands on it like this? Okay, then what you want to do is take a couple steps backwards while your arms are out here. You can take it a little more steps backwards. That's it, yeah. And then you actually want to just kind of glide your butt back a little bit. And you should feel a nice stretch kind of across your lower back and buttocks and down your legs. Can you glide your hips back like that? Keep your feet still, yeah. There you go. So this is a nice gentle stretch that gets the whole back and the lower quadrant involved. It should not cause any pain. All right, and then the next exercise you get to sit for. But you want your legs out in the aisle so you have room. You want to put your, let's let everybody put their right leg out. Try to get it straight and your heel on the ground. Then sitting very straight, you kind of want to just, again, glide your buttocks back a little bit, and you should feel a stretch in the back of your thigh down to your calf. You should hold all the stretches for about 30 seconds. Yes, heel is on the ground. So may not have the heel on the ground. And then switch legs. So again, your heel's on the ground, your knees straight, and just kind of glide your buttocks back with a slight bend forward. All right, and then the last thing is you want to, everybody should sit with their legs and both supported in front. And first I'm going to do it, then we'll be around to help as you do this one. You just want to bend forward and stand up without your hands. That's good. Yes, and then slowly go back down. Keep your arms across your chest if you can. So basically, after you're stretching, it gives you the opportunity to strengthen the muscles through the range by sitting and standing correctly.
So that is one of the tests that they can do, is a 30-second chair stand test. I'm sorry. 30-second chair stand test is one of the tests in your doctor's office. If they're not sure whether you have a strength or balance problem, they will do that with our program. So you might want to just try it at home and time yourself for 30 seconds and count how many times you can do the sit to stand. Good. Perfect.
Will your slides be available?
I think someone asked me that. Was it? Were you asking? Somebody asked me. Yeah. Oh,
Yeah,
maybe you did.
if you're okay with it, I can get them posted. We'll have that link to the bulletin just like the last one.
Yes,
Yeah.
I'm fine with that.
We can, just like the last presentation for Dr. Tu, we can put the link where you can go get them. And if you have any trouble, just contact me like last time.
So we are planning our classes for Stepping On in Tai Chi for the new grant cycle, which is July to June of next year. We're going to be putting out some flyers, and we do hold the classes across the city in different places. So I am happy to send the flyers to you guys and just, be able to see when the classes are and if it's something that's close here. We would love to have one in this area, so we'll be looking for that. I do the Stepping On and the Tai Chi. I'm not sure where the Otega and the Sale are.
The Otega is more of a one-on-one class or therapy session, physical therapy session. In the Sale class, we have offered at the Green Township Senior Center, so that's accessible to anyone.
All right, well, thank you. Let's give a round of applause to Cathy and Melissa. And thank you all for coming. One more big favor, as always, we have an evaluation forum. We really value your feedback. So if you wouldn't mind just taking a couple of minutes to fill it out. We've got pens. Just grab one of those forms. If you could do that, we'd really appreciate it. Thank you, everybody, again.